Um, Ben, I see you're on. Can you take care of that for me? I'd appreciate it.
No problem.
Um, I want to wish everyone a happy new year. Let's really hope that 2021 is kinder to us all. Hopefully we'll see some evidence of that sooner than later. But I tell you, 2020 was brutal for personal reasons as well as everything our nation has been going through. So, anyways, happy New Year to everyone, and let's just hope 21 is going to be better. Again, I told everyone the handouts are in the meeting. If you go to the little monitor, I think that's what that is. It looks like a little monitor to me with the red dot on it. You should be able to find the handouts for today's meeting, as well as the agenda. I did. Someone identified that I had the time wrong for one of the meetings, so I updated that in the agenda. So anyways, with that being said, we'll jump right in. Again, if you will type your questions in the chat, we will try to answer those during the meeting. I'm not going to ask you to hold your questions till the end, since all these topics are different. It's not like some of the other ones where they build on one another and you might get your question answered a little bit later. So go ahead if you think about it, chat in there, and if you need to unmute yourself to speak up, just let us know. So anyways, our upcoming dates, we do have our quarterly basic financial training on the 10th next month, 9 a.m. to noon. We do have, I want to say, 40 or 50 people signed up the last time I checked. For that, I will get out another email to folks so that they know about that training. At any time, you can go to our Finance and Audit Resources page and sign up. The survey link is on that page. So if you want to sign up for that now, you just go out to that page and the link is on there for you. The Finance and Audit Committee meeting next month, we just had our meeting this month. It's the first Monday of every month. So we had that yesterday, and the next one will be on February 1st at 3 o'clock, not 3:30. That was the typo I made. Thank you, Christy, for catching that. And then the Policy Committee meeting is next week on the 12th at 3. Commission meeting is the 21st at 10. This meeting here, the next one is February 2nd at 1. Then we have your quarterly financial reports for October to December due at the end of this month. Again, the link to submit that is on our page. Instead of you having to go find it in the email I sent or a memo that was sent out, we're going to start refreshing that link each year as it's updated, because that link does change as we create new sheets for new years. So again, to submit that, just go to our Finance and Audit page and you can go to that link. We do have Melissa Galasso coming back. If you all recall last year, those of you that were around, we're committed to doing, which you're going to be hearing a lot more soon about, finance trainings that we're going to start rolling out on a variety of topics early this year, actually. But if we're committed to making sure that our finance folks are well trained and have access to the latest and greatest information, as I don't know how many of y'all are in the finance area, but accounting and auditing standards change very, very rapidly. And what you did last year, unfortunately, a lot of times isn't what you're going to be doing next year. So without this opportunity, we find that providers rely inappropriately on their auditors for that knowledge, or don't have other access to that information. So we're taking the lead on that and bringing Melissa in. So this will be her second year. We learned some valuable lessons last year. One was that the session was way too long and had too much content and people were overwhelmed. So we've broken it down actually into 4 sessions this year, 2 hours apiece. And the dates are on the agenda: February 16th, March 2nd, March 22nd, and then April 7th, 10 to noon. I got that scheduled this morning with her. and we will be getting out some information for you all to sign up. And then, of course, we will open this up to auditors as well. What we'll have to decide is if we're going to charge for anything at all for this. For auditors, we wouldn't charge our provider network, but for the auditors attending, there is a value associated with earning CPE. And so we just need to figure out if that's something we want to do or not. We probably won't. If I had to guess, we'll probably just make it free for them. So anyways, the topics, accounting and auditing update, that's A&A. Fiduciary activities, GASB 84, that's huge. I think there's a lot of changes coming related to that standard that you all need to be aware of, and there's a good bit of effort. Actually, we have a conference call with the GASB board. I think it's Monday. Our situation is so unique. I talked to the writer, the actual author of GASB 84, and she could not answer my questions as to how fiduciary activities standard applies to DDSN with all the different types of consumer funds accounts that we manage, such as ABLE accounts, burial accounts, petty cash, cash on hand, checking accounts, trust funds, you name it. So with all that being said, I've been meeting regularly with Melissa and GASB, Lisa Parker, who wrote that standard, and actually we're going to have to go before the board Monday and try and get an answer from them. So there's going to be significant work there to be done, and we'll share all that with you at that session and probably in some other sessions as well. And then financial FASB leases standard and the GASB leases standard. So we decided to separate those so that if you're a nonprofit or a for-profit, you would want to attend the FASB leases session. So that would be even if you have HUD projects that you manage or foundations that have potential lease type relationships or agreements, that might be something you would want to attend even if you're one of our governmental DSM boards. And the government DSM boards will attend the GASB leases. And they are different, so they're not identical. So you have to understand if you're reporting under GASB or FASB when you implement things, because they're not always identical. Rarely are they actually. So those are the Galasso training sessions. More information, like I said, will be coming on that. We also will be setting up a fee-for-service training this week with you all. If you attended one of our sessions before Christmas, we had 2 finance training sessions to talk about fee-for-service, and we referred to having another training in January. So we'll get that set up probably mid to late, probably second or third week of January. Debbie and I have to get together and get with our folks and make sure we have all of our ducks in a row, because we're talking about presenting, for example, updated finance manuals and different forms and so forth. So we need to make sure we have everything in order on our side before we do that. So you should hear probably something this week on that training. We'll also record it. And the reason we'll record it is because I know if we only do something once, not everybody can attend. There's other things going on besides us having meetings here. So if you're not able to attend that, we want you to have access to the recording. So we'll get something out on that here soon. Under old business, just a couple updates on the BAN BNI fee-for-service project. Boards are working with Mary on ban change. The ban change process currently. So if you keep in mind, if you'll recall, this is a 3-phase process. Phase 1 of this process is simply shifting funding for folks you're already serving. If you have folks that are in a G that really need a H, but you've also identified someone that's a H that really could be a G, we're just moving that funding around to get that corrected. And then phase 2 will be actually awarding new H's. And then phase 3 will be if there's folks that are over and above and H that would be what was an old outlier. We don't know what the new outlier process is going to look like. We're going to be working on, I never can remember the number, 25010 or 25001 DD directive, which explains the capitated funding system and goes over outliers and so forth. So the real problem we're having is we need a high management residential rate that we can also defend and support with HHS. And the reason is, without that, we're basically just paying state dollars for those high cost residential placements. So we're trying to line up our processes to support our next fee-for-service phase, which will be bringing all these residential bands into fee-for-service. Also, a question came up at the Human Service Provider meeting this morning about case management and folks expanding beyond their counties. I sent out a memo. It's in I dropped it in the handouts. I didn't print it out, but I want to say it was sent out on the 15th. If you guys aren't getting these memos, you need to check your SPM. We put in the thing, in the documents that go out, what list we're using when we send those out. So if someone in your organization forwards you something, or you otherwise realize that you're not getting communications, then find out from us what SPM list you need to be in and make sure you're there, because what we're determining is that while we're trying to communicate and share this data, some folks still aren't getting it, or it's getting stuck in spam or something. So anyways, if you'll check, you can go to our executive memos page as well. That's where all the memos are stored, and it's a master repository. You'll find that memo there as well. But basically that memo stated that if you're a DSM board in good standing, process to go through to basically expand case management outside your home county. So we did issue that, and that's good news for folks that are looking to through looking at conflict-free case management, the ability to serve other counties in their case management department. As far as the BNI project, part of this gets really murky and confusing, because in the BNI project there were really three components of it. You had the 60% day program recoupment component. You have us paying you fee for service for day program back to July 1 at the full HHS rate of $31.29 a unit instead of $27.50. And then the third piece is us adjusting the residential rates for passing through the full, day program rate. So at this point, we've done all the pieces except for the residential amendment. So we've recalculated those rates, and I've kind of intentionally let that go cold so that I could do a cold review of it to make sure I didn't mess anything up. So I'll be trying to finalize and test those numbers and make sure they make sense, and then we'll get that to Deborah Leopard, get a new rate band table sent out to all the providers where you can see the components of the increase, and get you guys paid back to July 1st. So every residential rate is going to go up, every residential band. They're going to be a very diverse rate adjustment because of participation in day programs. So if you have a lot of SLP1s, for example, just a lot of those folks don't go to day program. And if you have CRCFs, pretty much all those folks will probably go to the day program unless they've chosen to stay home or stay home for other reasons. So we're looking at day program participation levels when we're assigning those costs to each band. It would be a mistake, and it would really hurt a lot of providers if we didn't consider that, because you'd end up getting shortchanged on your day program participation if you have a high participation out of residential. So that piece has to be done. We'll try and get that amendment out here soon. For those of y'all, I'm going to say this too. I think I put in let me check real quick in the handouts that I put in here. I put in the all the training materials from back in December that I was just referring to when we held those 2 trainings. All that is on our Finance and Audit Resources page, but I've put it in here for your convenience. All the timing of all these pieces are in those materials. And so, again, at the Human Service Provider meeting this morning, apparently somebody asked when we were going to do the 60% recoupment for day. Well, we've already done it. We're doing it for October through December next. Of course, it's only the 5th. We can't do through December yet. It's not even been 5 working days yet. We've already done that, and then the payment went out before Christmas, right?
Right. I believe they should have received them around the 26th of December.
Okay. So, which was a Saturday, though.
Yeah, I got an email from
Okay. So, anyways, you should already see that information. Plus, I sent a memo out on the 22nd, again, to SPM list. So, I'm kind of scratching my head on why folks don't know. We talked about it in those 2 trainings in December. We talked about it at the commission meeting. We talked about it. I sent a memo out on the 22nd, and then the actual payment's been taken for July through September. So I don't know what to say other than our system of communication is failing somewhere, and I got to figure it out because you folks need that information, I know. All right, so anyways, looking at those materials, there's a chart in there. It really helps. I mean, I did it almost really for my own purpose and my team because trying to understand all these moving pieces, there's a chart in there that is a timeline, and it'll help you understand when we expect these things to be done. And then the actual training video is out there as well, from the 16th or the 18th, one of those sessions we posted. And Deborah Leopard talked about the contracts and payment schedules and all that kind of jazz. So if you weren't able to attend one of those, you can go watch the video as well. We still do owe you for supported employment fee for service, July to September. We'll be getting that out here soon as well. The delay on that had to do with the rate. We have 3 rates with HHS for supported employment, and we had to figure out how we were going to address that, considering one of the rates is half or less than half of the others. So, we had some internal dialogue to figure out how we were going to handle that, because our obligation is to pass through the rate. If we pass through the rate, you guys are going to go kicking and screaming on one of these rates. You're going to go, whoa, wait a minute. We're going to get $20 an hour when you're paying me $80 on the other. So we had a real issue there to resolve, so we're going to have that state fund. Again, that's part of our use of this FMAP money. As we make these types of decisions, there's all kinds of little bits and pieces that's afforded us the luxury of doing a variety of things. And so we do still owe you supported employment for July to September. And then we also owe you an amendment removing all the BAM/Bs and Is out of your contract. So again, all that material is in the handouts that I've loaded. It's in the video. And if you do have questions, we'll be glad to try and address them one-on-one for, a particular person that might have an issue. I'm going to pause for a minute because we do have a lot of questions that are posed while I was going over this, so I'll try and address these. And I've learned to read them to myself first. Let's see. So the question was, where are the handouts for today's meeting? They're in the meeting itself. So if you look at by the red hang up button, there's a little monitor icon with the red dot. If you go in there and do manage content, you should be able to see all the handouts. Oh great, I just got an update notification. I was able to cancel it. All right, Will, Mitchell. So the question was from Mike about residential day program rates. increasing? Will it be across the board or based on actual day units? I thought you might have typed that in before I said it, but I'll repeat just to make sure I'm clear. We have reports that we run historically on what folks in residential bands participate in day program and those that don't. And so utilizing that information as well as supported employment, because we got a supported employment adjustment to do as well, we sprinkle that money into each band based on 520 units for those people in those bands that do attend or have attended day program historically. And so as a result, the residential rating gets adjusted on an average basis for statewide for the number of people in, say, Band G that actually went to the day program or were enrolled, or I'm thinking when you're using enrollment for that. And so it varies it's going to be varied by band, and it's also going to be, have a different impact on each agency as your average day attendance in each band may vary from what the statewide average is, but that's capitated funding. That's always been true. I mean, every time we spread money through the band system, inherently, you have winners and losers because you're dealing with averages. So if you're on one side of the average, you might lose money. If you're on the other side of the average, you make money. So most folks that have been around for years, will run a calculation and see, okay, well, they're giving me all this new money. How much am I paying out in this dollar pay raise or in this health insurance increase or whatever? And did I make money or lose money? And so that's just been reality forever, and that'll continue even in a market rate situation, because if you're outside the average, above or below, even if you're paid on a per unit rate, you're going to be a winner or a loser. So it's just going to be a little different looking. Let's see. Sorry, Diane, I didn't know you answered her. All right. And so did Ralph. Thank you, everyone. I should have read from the bottom up. Okie doke. So, Mike, if that didn't answer your question, call me or call Debbie, and we'll be glad to go over that with you in more detail. I try my best to explain things, but sometimes I might not be very clear. All right. Let's see. The next, I guess to close out the BNI project update, again, just to reiterate, in case you got on late, we're going to schedule another training here in the next 2 weeks that'll actually go over the nuts and bolts and logistics of the new fee-for-service processes. How do you get paid for DSAP, for day attendance? How do we get paid for support employment? What if we pay a bill for somebody that was previously a Band B out of our checking account? How do we get reimbursed for that? How do we get reimbursed for admin? All those types of questions, we will answer. All right, item 10. We had 2 items on the SPA agenda that we were trying to get through. One was related to Witten Center and a project we were doing over there, and it just got passed and approved before the holidays, and then we're getting ready to add now the 60-day facilities again, and we decided to tackle them one at a time just to make it easier for the folks on the SPA to State Fiscal Accountability Authority, for them to understand and not muddy the 2 issues. So we will be on the agenda in March again, and we are hoping to get a final decision from them on whether we will deed over or transition state-owned provider-operated facilities to you all. So those that don't know what I'm talking about, there are approximately 60. That number does change because folks are selling off and replacing some of these facilities. We have 60 facilities that we own that providers operate, and it's been a long-term goal prior to Pat getting here, prior to Mary getting here, prior to me getting here, to transition those properties over It was a recommendation by either the Senate or House or both, maybe even the Legislative Audit Council as well. So anyways, we're trying to finalize that project, and we'll keep you posted when that does happen. And then, of course, as we make that transition, we'll have to work with you all on insurance and any other types of logistical issues that we may need to address at that time. We are looking at if there are antiquated long-term projects that DDSN has not stepped up and taken care of over the years. We are trying to land on a process where we can fund, at least partially fund, some of these projects. Maybe some would be fully funded depending on the unique circumstances. But, you know, we all know that DDSN was short on cash, and for several years, projects were just not tackled. I don't know if they were ignored or you know, what the structure was and with the prior management, but I do know that there's a good many things sitting out there. So as we get closer to that March deadline, we're going to communicate with you all a process for you to submit and notify us of concerns you have related to these facilities, for us to look at it and make a determination as to whether we can or should fund any of it. Now, of course, we've got to get commission approval on anything we do in this area. Staff have already committed to what we think we need to do, but it's just a matter of packaging that and sharing it with the commission and making sure they're comfortable. You know, our opinion of it is if it's budget neutral, you know, we have a history of what we've spent for these facilities, and as long as it's budget neutral for a period of 2 or 3 years, then that's the amount of funding we might have to play with. And I'm looking at Pat because I don't know if he has a comment he wants to make about these facilities. No? I can move this over if you do.
No, I'm good.
All right. So again, more information will come out, and we will ensure that we reach out to everyone equally and give everyone a shot at enlightening us as to what issues might be out there. All right. Under new business, I'm going to let Debbie go over this thing on this DUNS. Hold on 1 second. All right, Debbie.
Good afternoon. Just want to make you aware of the fact that in April of 2022, the federal government's going to stop using the DUNS number, and they're going to what's called a new unique entity identifier, which anyone that is currently has a DOT grant or any other federal or state grants, you would have what they call a SAM number, which is System for Award Management. They're going to flip everything over to that number. They're no longer going to go to a third-party website to obtain it. And you'll have to get yourself a SAM number. It's very easy to do it. I think the majority of the boards at some point or time do work with DOT, and you had to have it, I think it was about 3 years ago, you had to register for SAM, and then you also have to renew it annually. If you have any questions on that, it's very clear and simple out there on the GSA website. If you go gsa.gov/entity ID, that's ENTITY ID. It goes through and explains everything, because actually this was supposed to happen in December of 2020, and they've extended it to April of 2022. It will affect things down the road, if you don't have it, so you might want to just go out there and read the information that's out there. It's self-explanatory.
Ben, can you mute again for us, possibly? So, just to be clear, DDSN doesn't require you to have a DUNS. This is just us trying to be information sharing of things that we understand are pertinent that each of you are dealing with, whether it is a DSN specific issue or not. So if some of you are wondering what the heck we're talking about, if you've received federal awards in the past, DD Council I think might require it, DOT, maybe USDA food program. There's a host of federal awards that required you to have a DUNS through Dun and Bradstreet, and so that's what Debbie's referring to. So I just want to make sure, if you're not getting what she's talking about, that you have nothing that you have to do with us in regards to that. We're just information sharing. Okay. All right. Item 12, the FFCRA, or the Families First Coronavirus Relief Act, expired at the end of some of the provisions expired at the end of December, such as emergency FMLA and emergency paid sick leave. If December 31st rolled around and they did not extend it, then it automatically sunsetted. At this point, to my knowledge, they still have not extended that, and I don't know if they will. But the point I want to make is that you need to unravel those programs on your end. You're no longer required to offer those, and you can't claim the credits. And some of you are governments, and so you never could claim the credits. I think there was some rules in there about Social Security tax not having to be paid on those types of payments. There's all kinds of weird rules. So anyways, I just want to make sure that you're aware that those rules did lapse, and you will need to reach out to whomever you work with if you need guidance. We're not the experts on this. We can hook you up with our HR folks, but it's going to be she's very state specific, so I'm not really sure that that's the best resource for you either. Although we'd be glad to try and help you, but this is outside my lane, and it's just really not, we rely on state HR to help guide us as a state agency, but be aware of that. All right, hold on 1 minute. I'm going to give you back to Debbie.
You should have received a memo from me last week regarding the standard mileage rates for 2021. They dropped another penny and a half, so the new rate now is 56 cents per mile. In my memo also, just remember that you don't have to offer the full 56 cents. As long as it's in your policies, procedures, in your information that you're going to, whether it be 35 cents or based on different types of circumstances, you don't have to do the full 56 cents. And I put that in the memo also. Yeah.
So the IRS standard mileage rate is what it's trying to do is ensure that you're not basically creating non-taxable income to your employees by paying them a rate that they think is excessive. So the reason they set this is a ceiling, not a floor. You cannot go over 56 cents. If you do, it's compensation, and you have to put it in their W-2 because it's not a tax-free fringe benefit at that point. So what I'll caution you with here strongly is anytime the IRS rate goes down, if you end up paying or compensating through your reimbursement process at the old 57.5 cents, technically that penny and a half times the miles per driven needs to be on their W-2 and grossed up. So it's very important that you get this updated and that you ensure that you're paying your employees no more than 56 cents per mile. Okay? All right. Room and board. Wow. Again, I'm gonna blame DDSN on this one. I was out in the provider world and feel that a lot of the issues we're seeing were created by us, and the lack of clarity in the way that we do our jobs here. So we have added the room and board calculations to the audits. Many of those came in incorrect from a standpoint of missing altogether, didn't show each house, didn't break out the HUDs, didn't put in the right number of, reporting a 8-bed CRCF with 4 beds, not putting the admin allocation in there, formula errors all over the place on some. We're having a fun time right now with room and board reviews. Now, a lot of those examples, that's not DDSN's fault, but we're running into a lot of issues where there's just, I guess in our past practice of reviewing and approving room and board, it's been more of a tick and tie process. Yep, that equals, yep, that equals, yep, that equals, and just running with it versus really reviewing what's there. And pretty much for the vast majority of the ones we've looked at thus far, there are issues with them. So primarily the areas are related to not grossing up food cost for SNAP benefits. That is an accounting issue that we probably need to talk to each individual board about to make sure they understand the accounting issues there, as well as the easiest way to accomplish that in your accounting records. Also, admin allocations that aren't really agreeing to the audit or the cost allocation. We pull the cost report and we have cost report things being backed out as room and board that are not on, that don't agree with what is on the audit or vice versa. So if you're familiar with the cost reports, you have a column to remove room and board. Theoretically, if you do it properly, the total room and board cost should equal the total room and board cost in the audit. Now, those numbers, if done properly, they should be identical. They're not in most cases. So we also have issues with cost allocations not being done properly or including things that they shouldn't. For example, folks allocating residential admin to room and board, which doesn't have anything to do with room and board, but could have components within residential admin that maybe are properly categorized as room and board. So it kind of runs the gamut. So what Debbie and I have discussed is we can't go for perfection in 1 year. We've got to decide what's important to us. We do not want to hold up all the room and board reviews for perfection. That is just not advisable. We just need to make progress. So what we will be doing, and we've already been reviewing these, is we'll be meeting as a team to identify which room boards we can go ahead and just approve, even though there may be questions we have. For those, how do we communicate that to the board to let them know, yeah, we're approving it, but there's still some things we need you to look at, or those that are they just need to be redone, and we do have some of those. I've looked at several and I'm like, yeah, this is not going to work. So we've got to figure that out. The dilemma is most people change their room and board in January. You folks have already billed probably your room and board for January. Maybe even consumers have paid you already. So we're cognizant of that, and we understand that the later we are in getting you back an approved rate, the more of a mess you have to clean up as far as correcting prior charges. But that, unfortunately, that's growing pains. I mean, one of the issues we have, and one of the reasons we're going to be running late this year, is we just gave so many extensions on the audit that we got bombarded with audit reports around the due date, and it's a lot of compression with everything else we're doing here. So, in a normal year, we would have had another 30 to 45 days to begin looking at these, because we wouldn't have had a November due date, or I guess October is the normal due date with the revised directive we did. But so we're going to have some growing pains. We apologize for that situation. and we're mindful of it and feel bad. I mean, Debbie and I met this morning, and we really couldn't come up with another solution at this point. But what we're going to do is try and focus our energies on those that are close to being correct. Go ahead and get those out so that folks can do what they need to do, and then those that need work with each of those boards to get that stuff fixed. And then also, we've got to reach out to the QPLs. Many QPL private providers are December year ends or March year ends or September year ends, and we don't even have their audits yet. I'm not holding my breath that the private providers that offer residential services will add the schedule that they're supposed to, because again, we had many of our boards even that didn't add it this year. So number one, we don't have their audits in yet. Number two, even if we did, if we get some of them in here soon for other year ends like September, they're probably not going to have what we need. So we've got to reach out to private providers, get them to turn in their calculations, and we'll have to do that as a separate process, similar to how it's been done in the past for those particular providers. Did you want to say anything about room and board? Speak up, because I got to speak over here.
Just that as we're going through and we're making the approvals, on anything that we see that could be a potential issue, you know, as Chris said, we'll approve it, but we also want to convey to you what we determine to be an issue so that you can work toward correcting it for next year.
And then with that, the directive is it's a very minor, small version of what it needs to be. It probably is going to end up being a 8 or 10 page document when I'm done with it. There are a ton of issues that I've expressed when I was out in the provider world. I have a list of like 80 things that were wrong with the room and board directive that fell on deaf ears with management up here. So now that I am management, I need to fix it. And so there's a whole host of issues that even relate to HUD projects, market-based renters that are in a subsidized house, but the bed they're residing in isn't subsidized. Issues with where they have no income, but they have assets, because room and board is an income-based charge. So if I have somebody that has no income, but they have a trust or they're private pay, then current room and board, you can't charge them anything because they don't have any income, which is ludicrous. So there's just a whole host of issues with the room and board directive. I'm going to be working on it over the next month or two. It'll go out to you all for comment in March. And so we will make sure we mention that to you when we get closer to that date, that will be out there for you to comment on. It will be massively different, I can assure you of that. And we will also follow that up with the training to ensure that providers know what they need to do in room and board. And again, I blame DDSN for the issues we're having in regards to some of the problems we're finding. So again, don't take that I'm slamming you all. I'm not. You know, and even schedules that are missing and things aren't done right. It's the first year. You expect hiccups with the first year of anything. You're not going to go from, you know, we've never done this before to perfect. You know, 100. That's just very rare. So we're realistic, but that doesn't mean that we're not going to communicate back to you the things we're finding, because the only way to fix things is to know that what you're doing is wrong. If no one tells you, you don't know. So we've got to fix that feedback loop, and we're committed to that. And again, if we do that, don't take it the wrong way. We're just trying to get better as a state. All right. Cost allocations. Basically, that's in neutral, unfortunately. Debbie did start looking at those back in November when you were turning them in. We had a lot of new folks in cost analysis, and the folks that were there due to needing to take leave off and other things that were impacting their ability to be at work, as well as competing priorities. We just haven't had to get time to get to cost allocations the way we need to. I can't say that those are going to be as much an issue as the room and board. I do know we're going to have spots, individual areas where there may be some feedback, but I think the state as a whole is doing a decent job on the cost allocation side. And the issue is when you're training brand new people and they're new to cost allocations as well, we need to do a really good job with our team getting them up to speed before we have them reviewing things. So we have had internal training, but again, due to other priorities and folks being off, we just haven't made the progress there we need to. Debbie, I guess, probably this month in early February would be a reasonable expectation for us to start trickling out some reviews.
On the cost allocations?
Yeah.
Yeah, no, I'm thinking sooner than that because I've taken them back.
Okay.
So I'm going to start working on those, tomorrow.
Okay, and the other holdup we have is, and I'm going to fix this in the audit directive this year. We have never required the agreed upon procedures report come to finance, and now that we've got so many financial related things in there, that was an oversight on my part to say we don't need that. So if you'll remember, in the agreed upon procedures, one of the areas was the review of the cost allocations. So if your auditor's out there looking at that and has identified some issues, and we're not even looking at that in finance when we're looking at your plan, that would be pretty dumb on our part. So we're having to work with internal audit, which they've graciously agreed to assist us with this, to get the information out of your AUP letters as it relates to cost allocations and room and board. Both of those areas will be getting that information. So that's also one of the delays that we're dealing with. Okay. Number 16, there are 2 directives that are out for public comment or will be today or tomorrow. That you can get to those on our website. And again, I'll say this for those that maybe haven't heard this before. You can comment on any directive at any time. If you go to our directives list on our website, there's a link to comment, and it goes through our administrative pool, and they will communicate that to the owner of the document to let them know there's a comment. So you don't have to wait till directives are out for public comment to comment, but when they are out for public comment, that means we've been working on them. The policy committee and or finance and audit committee have reviewed them, and now it's getting kicked to the provider world for 10 days. Is that right, Pat? Is it 5 days or 10 days? 10 days. 10 days for you to comment on. Once we get your comments, we decide internally whether we need to do anything differently, and then run it back through those committees and then on the commission for a final review. So the 2 that are out there right now, or will be very soon, is 200-01. That is cash on hand for maintaining at the residential level. That particular directive, I do think you need to look at it. What I tried to do in that directive, I don't know if you attended the Finance and Audit Committee meeting yesterday, so if you did, I'm sorry for boring you with this comment, but one of the issues I've always had is people's right to privacy and the expectation established in that directive that you're going to go into a consumer's room and basically, go through all their belongings and their wallet and trying to identify all the cash they have, because the way cash on hand is defined in the directive is not only the cash managed by staff in the residential office, but also any cash that the consumer has. And so the obligation was that you need to ensure that those 2 added together didn't exceed your maximum cash on hand limits. Well, I have a major problem with that because, yes, we're trying to protect consumers and make sure they're not taken advantage of and that they're not losing money and folks aren't stealing from them, but you're basically violating someone's privacy for that. And so trying to balance those, I think what we put in there was more, you should have an awareness of what type of money consumers might have, but we're trying to get away from you having to go through their wallet and go through all their drawers and look under their mattress. That's the biggest substantive change in there. But there are a good many changes in that directive, but it was more clarification and flow and wording and so forth. So take a look at that comment. I would be anxious to hear any comments, good or bad, back on that one. And it would probably be applicable, let's see, this will probably go final publish in March once we go through all the process. And then the other one is 200-09, which is residential fees for ICF IDs. This particular directive really just goes over if you have an ICF, rules on the per diem and how do you count the consumer's income? How do you determine their personal needs allowance? How do you deal with if they're not Medicaid eligible? Those types of things. The only substantive change I think that was made to that was I grabbed the language that was in our contract with HHS. We have a separate contract with them on ICFs. Believe it or not, there are a good many issues in our contract with HHS related to personal funds, and these items were not communicated to you all anywhere, yet you're the ones required to to fulfill them. And so basically I just popped that information into the document, and tweaked it a little so it flowed properly. So 200-09, if you don't have ICFs, I wouldn't worry about it. If you do, you might want to look at it. But again, I don't expect, you may have some good recommendations on language or flow, or if it's not clear or something like that. But I think substantively, you'll find that one, really not anything big to worry about. When do I expect directives to be available for public comment? Well, these two, I know Colleen Honey was working, that's our administrative assistant in policy. She was working with me this morning to validate which versions, making sure we were clear on which versions, because we have a lot floating around here as different staff give their comments that needed to go out for external review. So I'm pretty sure they're either out there now, will be out there later today, or in the morning. But again, just check the website and keep an eye on that. Definitely today or tomorrow, I would say. All right, item 17. As you all know, we revise the audit directives annually. Typically, those are issued in April or May. We want to try and issue those earlier because audit firms and providers need to know what changes are coming as soon as possible so they can adjust accordingly. So we're getting ready to start actually on the audit directives for this fiscal year that we're in. A couple things that I want you to be aware of that we're talking about and looking at. First thing is, I'm probably going to get rid of 27506 and just have one audit directive and put some charts and tables and information in one directive so that there is an audit directive period. That to me makes a lot more sense than the way it's done currently. Secondarily, probably going to add some cost reports requirements in there because really there's nothing ever anywhere that I can find that talks about your requirement to submit a cost report other than a memo that says, don't forget to turn them in by September 30. So probably going to build some cost report stuff into it. And then the big lick, and we expect probably, some significant negative feedback or backlash on this one, but we'll deal with it and figure out where we need to head with it. But prior to me getting here, And prior to our current commission, actually, there was a review of whether we need to implement mandatory auditor rotation or not at DDSN. And that is a concept that's been looked at industry-wide, nationally, internationally even, and trying to identify the pros and cons of implementing that requirement. And I must say that, frequent mandatory auditor rotation, let's say every 5 to 10 years, really does concern me from an audit quality perspective. I don't think the advantages of switching auditor firms that frequently accomplishes anything. The audit quality, study after study, has shown to really suffer for the first year or two anytime you switch an auditor firm. So you're really losing some audit quality for a couple years, and then technically, if I'm an auditor and I'm in my last year with you, you've got to ask yourself, how much effort are they really putting into this when they know they're getting ready to lose your business? So, in a 5-year transition phase, you're talking about maybe 2 years of quality audits. And so that is self-defeating. That really does not accomplish anything at all. So I am trying to educate our Finance and Audit Committee on this, and trying to ensure that they're aware of the scholarly, independent studies that have been done in this area, and try and figure out whether they want us to do something like this or not. Personally, being an auditor and understanding the huge lift it is to take on a new client, personally, I support it, but it would have to be really like 15 or 20 year type period, not 10 or less. So my recommendation, I need to talk to Pat, I need to talk to Kevin, talk to Debbie, see, build some internal opinion on this. My personal opinion, just me, is that either leave it alone or make it really, really extended so that we're not losing audit quality and having all this turnover so frequently. So that is going to be a big one, I know. One thing I'm going to do here soon is I'm going to send out a survey and ask providers to tell me how long they've been with their current audit firm, and maybe get an idea through maybe some check boxes or drop downs on what types of services you're getting from them. People get tax services, they get consulting services, they have their financial statements prepared, they have their cost reports prepared, they have their agreed upon procedures done, they do their depreciation schedule, they might do all their GASB adjustments. There's all these things that auditors are doing, and just trying to really get a good feel for the landscape out there, so that we really understand kind of what we're dealing with. I fear that we're going to try and do something that we think is going to make things better, and it's actually going to make things worse. And so we'll keep you posted on that. We might even have some forums or town hall type meetings with you all, because I know there's some very, very strong, I have strong opinions on this, so I think
Both ways.
everybody has strong opinions in this area. And so I think it's prudent on our part to kind of hear what you all might have to say, because that is a big, big change if that's something that they really want us to do. So, all right. Item 18. Just want everybody to know that Josh Baker, his last day is this week, Friday, I guess, of this week. He's the Director of Health and Human Services, and that's really a big, big, big loss for our provider network. We have built an extremely positive relationship with HHS, with Josh there. Mary and Josh talk, many times a week, and so he really has been very responsive to her and really listened to our issues and been very open door and open-minded. So with him leaving, we don't know who the interim's going to be. We still don't know, right, Pat? So that's scary. We don't know where we're headed right now. You know, they're our primary funder, so that relationship is critical. We also lost Erin Boyce, who was the chief of staff, which is like an assistant. She also left. So, you know, the upper ranks are gone. And so we've got, you know, the next layer down, probably one of them will be tapped for the interim job, I would imagine. And I don't know when we'll get, because the governor appoints that, right, position. So we'll have to wait for a gubernatorial appointment and related to that. So the problem with this is that it really stymies a lot of things we were making a lot of progress on. So unfortunately, we're going to have to start over on some stuff. Luckily, there still are some really good key people there that understand EDSN and have been part of this. All these projects we've been working on, but of course, you know, will they leave? I don't know what the turnover is going to look like and where it's going to stop. But I just wanted everybody to know that kind of does, you know, throw some water on our fire with Josh leaving, and that's really bad news. Let's see. Okay, so Melissa said that the directives are out there for public comment right now. She went and checked. You are correct, Joe. So with auditor rotation, instead of mandating firm rotation, part of auditor rotation does not necessarily equal auditor firm rotation. So the issue is if you have multiple competent auditors in the firm, this is typically the larger firms, yes, transitioning and rotating the actual audit team accomplishes the same exact thing. And so that is part of what we will be looking at. In fact, I know many firms, not many, several firms I'm aware of intentionally worked on engagement team rotation to simulate auditor rotation, firm level. So you're exactly right, Joe, and any guidance we would issue would consider that as a viable alternative to actually changing firms. You know, the only issue with that at that point is that, you know, it's a competitive disadvantage to the smaller firms that don't have multiple audit partners. But, you know, that's not, to me, that's not a reason to not consider that. You know, it's that we're not here to ensure fair competition necessarily. We're wanting to get the quality done. And so, yeah, that could benefit the larger firms and hurt the smaller ones. All right. So the question was, if there is an auditor rotation, would that affect this year's audit? I don't think that's appropriate. I think the situation we would have is we would go ahead and develop it into the directive and establish, first of all, it needs to be if it does go through, it needs to be a phased-in approach. We can't have 20 entities changing auditors all in 1 year, because I don't know that you're going to have enough interest and enough firms to bid on that much work. So for example, if I was back in my old accounting firm and let's say it was mandatory auditor rotation and I got an RFP, a request for proposal, from 15 of you, I'm only going to bid on 2 or 3 of them. I'm not going to bid on 15, because I cannot, if I win 15 audits, I am hosed. And there is no way I can complete that work. So the risk we run is if you don't do a phased-in approach, you're going to have a host of, you're going to have a whole lot of unintended consequences. You're going to have auditors that potentially overbid, thinking they weren't going to get all the work, and they did, and now they're not capable of handling it. So there's an audit quality issue, because now you don't have the staff and you don't have the skills to do that much work. You got folks that don't get a bid at all because they're not big enough, and maybe other firms are going after the bigger ones. No, we cannot make it applicable this year. And in fact, I don't know that we could make it applicable next year. I think this is a multi-year, phased in, okay, Board B, you've had the same audit firm since inception. They've been there 43 years. You're first. You have to switch auditors. Board C, you've had the same auditor for 15 years. You know, you're maybe in phase 3. So it has to be a phased in approach. Honestly, I don't know if it'll go through. Once you read all the negative results of auditor rotation, mandatory firm rotation, you have to start to question whether that really is accomplishing a whole lot. So again, it's a matter of us being able to communicate that effectively, and if our commission disagrees with that or sees that they want to do it anyways, then we'll just have to tackle that when that happens. I agree that. Sure. That's also true. So Susan commented that many of you are in multi-year contracts, and that's entirely correct. We're not going to ask you to break an agreement that you have. So, you know, we may ask for evidence that you are in a contract, so that, you know, we'll have that for our file if that is the reason. Even though in your situation you've had the same auditor 25 years, you're in year 1 of a 5-year agreement, we may have to phase you out at a different time because of that existing arrangement. Very good point. All right. The final thing, actually it's the final thing on the agenda, but I have 2 more things to talk about. The EVV, electronic visit verification. This is one of those things, again, that's been hanging around this came out 3 or 4 years ago probably, right? This whole project. And it's been delayed and deferred, and then COVID hit, and so it's been a kind of a mess, but many of you have probably heard of this. It's a time and attendance system, basically, that it's a federal mandate. It's not a state mandate. It's a state mandate too, but it's a federal mandate. If you want Medicaid money, you implement EVV, so no questions asked. So the issue has been HHS was taking the lead on that project, and we were looking at, all right, we have a whole bunch of systems here, and so a lot of stuff integrates, doesn't integrate, talks to one another, won't talk to one another. So as we looked at the EVV system, we were talking to HHS about working with them in theirs versus using TheraP, and which direction we wanted to head. And so because they had a lot of procurement issues on their side that are fairly complicated, their ability to select a vendor was delayed. And so basically we're in a penalty phase right now. We're required to implement January 1st, and we're not implemented. And the reason is we were planning on working with HHS on their system versus through TheraP, and there's a lot of reasons for that I think you all would agree with if we wanted to have an open discussion about that decision tree. But with that being said, at this point, we really have no choice but to join HHS's EVV system. And so that is something that they're trying to implement by January 2022. And we will be sharing more information with you all as that comes out. But I just thought you might want to know where we stood on that and when that might be hitting, because a bunch of y'all that have been around are probably like, well, shouldn't we have done that already? Like, are you going to hit us with this out of left field? And we're going to have to scramble to get this done, and do we have to find our own systems, or are you going to provide it for us? And so that's the purpose of me sharing that information. We will be working with the remnants of the HHS team to move forward with their system, and they're already using a system for other waivers and other services. So we're just going to piggyback on their processes, and I think it'll be a lot better, quicker, cleaner, streamlined, especially when you consider fee-for-service world, to have all that information integrated. Did you want to comment on EVV?
Nope.
Okay. All right, and the final thing, similar situation that you're probably wondering about. So Appendix K, they're supposed to lapse here soon. These are the little amendments, if you will, that we did to the waiver during COVID. They're time-limited things, and Lori Manos has been trying to get CMS, again federal, not state, to commit to whether they're going to extend those or call them quits at the dates that they're currently designed to expire. Well, the problem is with the date, even though it's still far down the road a little bit, the work that needs to be done to unravel Appendix K or to retain it, either way, is a huge lift. I mean, Lori started explaining all the things that had to be done, whether we kept the K or whether we got rid of the K. Either way, there's a lot of work to be done, and the work's not the same work. So you you have to know which direction you're going. So apparently Susan Beck is going to be issuing a memo out in the next couple days regarding Appendix K. I'm assuming Pat will review that here soon before it goes out. But it will notify you of kind of what we're doing here in regards to this. Basically what has happened is we have been able to get HHS here in the state to agree to a March 31st date to transition. If in the meantime we're still trying to get them extended, but at least we have 3 months now to find out for sure if CMS is going to extend the January, I think it's January is when it's supposed to expire. So they basically have said, look, we'll continue to pay your claims and pay on the K even though it's lapsed through the end of March. So again, a memo will be coming out about that, and hopefully that'll clarify, and I'm sure Lori will go over that in her case management meeting and so forth. Rebecca says it expires January 26th. Thank you, Rebecca. Yeah, is that all the Ks or just one of them? So we have multiple. So I didn't. Okay, she's not sure. So anyways, I just wanted to update everybody on that. With that being said, I'm going to kick it to Pat for closing remarks. He doesn't have any.
I think you did a fabulous job on this.
Okay. Does anyone online, Ben, anybody at DDSN have comments they would like to make at this point? And if not, I'll open it up for questions from the audience. Ben, you don't have anything?
No, I think you covered it.
All right, great. Diane, do you have anything to comment on in regards to room and board or cost allocations?
No, I think you did a good job.
Okey-dokey. I'm not looking for compliments. Deborah Leopard, you got anything?
Hi, everybody. I just want everybody to know I'm working right now on those BI conversion amendments. And I think that I'll have them finished up tomorrow and hopefully get them out by the end of this week. So be looking for those in the next few days.
Great. Thanks, Deborah. All right. Anyone out in provider world have a question? Feel free to unmute yourself or chat in, and Ben can unmute you if you don't know how to do it yourself. He unmuted the audience. Anyone have questions? All right. Jason, I might need you to unmute yourself here in a minute. I'll see if I understand it. So he's asking, so at this time, the ability to build day units in residential through March what date will you be seeking to extend to beyond? Oh, I see what you're asking. So the Appendix K, it allows you to build a program within the residential program. Gotcha. I'm with you now. I thought you were asking a fee-for-service question. Yeah, I guess that would continue through the end of March. I will make sure Lori addresses that in her memo. That is an excellent question. And I did not bring a pen.
Here.
Thank you. Thank you, Jason Tavener. Anything else? Come on, Susan Johns. Come on, Ralph Courtney. Y'all don't have anything?
Ralph.
They're the reliable ones, right? Susan did ask a question. So maybe she used up her allowance. All right, guys. We appreciate it. Be on the lookout for lots of invites to stuff coming your way for the various trainings and, yeah, the trainings. There's like 6 or 7 of them. So, all righty. Susan, you used them all up? All right. Okie dokie. Well, y'all have a great one. I appreciate you all. Take care.